heart is always better. Thank you.
Okay, no, you put volleyball collars. No, we got something else in common.
Director Rice, thank you for those words. Always from the heart is better. And you know, for folks that are watching us online around the world, this is not something that's exclusive to Florida. Fire departments all around the U.S. embrace you know, our thinking and team collaboration. So before we get started with our subgroups and learn a little about them, we want to share with you two really important updates. There's really great resources that happen around the U.S. in cancer control and prevention. The first one is the National Firefighter Registry, or NFR. It's an important resource nationally for all of our firefighters. And here to present about it is our very own Dr. Kenny Fent. Dr. Fent obtained his Master's of Science and Doctorate in Environmental Sciences and Engineering from the University of North Carolina at Chapel Hill. Dr. Fent joined NIOSH in 2008, where he currently works as a research industrial hygienist. Some of his more notable research at NIOSH has been assessing the dermal and inhalation exposures to combustion byproducts in firefighters. Currently, Dr. Fent is involved in a comprehensive study of cardiovascular and carcinogenic risk during modern firefighting. And on a personal note, when the NFR was enacted back in 2018, he was assigned by NIOSH and the CDC to take on this really tall order, right? Create a national firefighter registry and enroll firefighters with and without cancer into the registry. So we're really fortunate that at the national level, Kenny and his team are leading this endeavor. So please join me in welcoming a warm welcome to our virtual presenter, Dr. Kenny Fent.
Thank you, Alberto. Good morning, everyone. I wish I was there in person. I'm in Canton, Ohio, because my two high school kids are in the Ohio State Championship swim meet. But I'm pleased to be here to provide an update on the National Firefighter Registry. So I want to begin with an exposure pathway diagram for structural firefighters. So this really just illustrates how complex the exposure, the way firefighters can be exposed is. So it's not just what firefighters may inhale if they're not wearing respiratory protection, but it's also the contaminants that may get on their gear or get through their gear and get onto their skin, or the contaminants that are carried outside of the structure and then off gas from their equipment where they can be inhaled or transferred to their skin where they can be absorbed, or even be ingested depending on hand hygiene. And then many of those contaminants can also be carried back to the station into, the apparatus. And we know that many of those contaminants are persistent and will last for a long period of time. So what about wildland firefighters? So wildland firefighters can be exposed to many of the same contaminants that structural firefighters can be exposed to. Really depends on what is burning. But even when you burn vegetation, you're going to produce known carcinogens like benzene and formaldehyde and PAHs. But once you have man-made materials that are involved in those fires, then you have a lot of other, compounds that can be produced, including halogenated chemicals. The big difference, though, with wildland firefighters is that the gear that they wear is lighter protective clothing. They typically do not wear respiratory protection. They're in smoky environments for longer periods of time where they're performing arduous duties, in some cases weeks at a time. They can gather a lot of soot on their skin and clothing. And because they have limited access to water, it's harder for them to keep their skin and clothing clean throughout the period that they're out there. In terms of the exposures that they have, it's not just chemical exposures. Firefighters are exposed to night shift work, sleep disruption, UV radiation if they're doing a lot of outdoor work, diesel exhaust from the equipment that they use, of course, products of combustion, and then other materials that are released that aren't combusted, and that would include asbestos. And so when we look at the International Agency for Research on Cancer, or IARC, which is really the world's governing body that classifies different classes of materials as to whether they're carcinogenic or not, we see that many of these classes are either group 1 known human carcinogens or group 2A probable carcinogens. So you probably have seen this infographic already, but this is from the IARC evaluation of the occupation of firefighting. So they actually looked at your occupation as to whether it's carcinogenic. And this was just a few years ago, and classified firefighting as a group 1 known human carcinogen based on sufficient evidence of mesothelioma and bladder cancer, as well as limited evidence for 5 other cancers. And that includes colon, prostate, testicular, melanoma, and non-Hodgkin lymphoma. And so IARC really puts to rest whether there's a question about firefighters' risk of cancer, but there are still many questions that remain. And these questions include, how is the cancer risk changing over time? So many of the studies that have been done were performed on firefighters who were employed decades ago. And of course, we have a lot more synthetic materials in our homes and structures than we used to, which may be changing that cancer risk. How does cancer risk vary for volunteer firefighters as well as other subspecialties of the fire service, including arson investigators and wildland firefighters? How does the cancer risk vary for different demographic groups? And that includes women and non-white firefighters. How does the cancer risk vary regionally across the United States? How prevalent are rare forms of cancer? So to really be able to study rare forms of cancer, you need a very large population that you can follow over a long period of time. How does the cancer risk change with increasing exposures? And that includes major events. And we see these every year. These are events like the Maui wildfires, like the East Palestine train derailment, and talking with firefighters over 30-year career. Most firefighters have something like that in their career. And so how does that contribute to the cancer risk? And then to what extent do control interventions help? Are they actually helping to reduce firefighters' risk of cancer, and to what extent? And there are many other questions that remain unanswered that we need to study. And so those questions are really the motivation behind the NFR for cancer. This was created through an act of legislation, and our mission is to generate detailed knowledge about cancer in the fire service through a voluntary registry that reflects our nation's diverse firefighters, and then to take that knowledge that we gain and give it back to the fire service and public health communities so that they can take initiatives and measures to reduce firefighters' risk of cancer. And the components of the NFR are to collect self-reported information about firefighters and their work, to obtain records from fire departments or agencies to track trends and exposures, to link with health information databases, including state cancer registries, and then to make de-identified data available for external researchers. So, in the United States, cancer is a reportable illness. It's reportable to all 50 states. So if you are ever diagnosed with cancer, your cancer is reported to, in most cases, the state health department. However, states do not collect detailed information about occupation. Some states do collect information about your occupation, but it really is hit or miss. And it really depends on whether your occupation is listed in your medical record, which is often not the case. And it's certainly often not the case if you're a volunteer firefighter. And so the way that what the NFR is doing is providing a way for firefighters to register, to tell us about themselves and their work as a firefighter, so that if they ever develop cancer, even 20 or 30 years down the road, we're able to link their occupational information with their cancer outcome. And when we do that for firefighters across the United States, we can better understand the relationship between firefighting and cancer. And so this graphic at the top here, we have occupational exposures on the left, we have cancer outcomes on the puzzle piece on the right. And really the missing piece of this puzzle is information about the firefighter. And again, that's what the NFR is trying to fill. So in terms of who is eligible, the NFR is open to all firefighters. You do not have to have cancer to register. And it's actually just as important that firefighters without cancer register, because we need to understand why some firefighters develop cancer and others do not. It is a voluntary registry, but it's really, really important that we get a really, broad cross-section of the fire service. So we are interested in enrolling firefighters who have been underrepresented in research, and that would include the aforementioned women and minorities, volunteer firefighters, wildland firefighters, and then all those other specialty areas like fire investigators and instructors. And our goal over the next few years is to enroll 100,000 firefighters. Enrolling in the NFR is really straightforward. You can visit our web portal, nfr.cdc.gov, confirm your eligibility, which is just that you're 18 years of age or older and have served at some point as a firefighter. You'll create an account, read and sign the consent form, and fill out the user profile. Those first 5 steps can be done in about 5 minutes, 5 to 10 minutes. So if you've been putting this off, don't put it off any longer. You can get started really, really quickly. And once you fill out that user profile, you will receive an NFR participant number. The longest part of this is the questionnaire. We ask questions about demographics, work history, health history, and lifestyle. The reason that the questionnaire takes a bit longer is really that work history section. And that's because we need to know about your work. If we want to understand how your work relates to cancer outcomes or other health effects, we need to collect some information about your work as a firefighter. Once you register, we will be linking to state cancer registries periodically over time. There are 50 state cancer registries. The NFR is unique in that we are linking to all 50 state cancer registries. That is a big undertaking. We will be leveraging the North American Association of Central Cancer Registries virtual pooled registry to carry that out. And that, of course, will allow us to capture cancer diagnoses from the firefighters who are registered. We'll also be linking to the National Death Index, at some point, so that we can also look at causes of death. We are required by law to make the data publicly available while protecting privacy. And so we have an assurance of confidentiality, which is the highest level of protection. Basically means that your identifiable information cannot be shared with anyone outside of the NFR program, even under court order. And so what we can do is make de-identified data available to external researchers, and we are currently working on a secure mechanism to make that de-identified data available. Some other initiatives is that I'm wearing this shirt. I don't know if you can see it, Extinguish Cancer, that Miami provided to the speakers, and that is definitely consistent with our mission. So we want to reduce cancer, prevent cancer, and so we've worked with Underwriters Laboratories and their Fire Safety Academy to produce a cancer reduction course that's freely available at this URL. Provides evidence-based recommendations to reduce exposures and other factors that may lead to cancer. Some other initiatives that are coming soon is that we will be reaching out to specific fire departments to start targeted enrollment, where we will be working with leadership to encourage participation at those departments, and we can actually track participation rates. We're also working on special recognition for fire departments that achieve high participation rates. We're working on a public dashboard with summary statistics. So you won't have to listen to me. You can actually go to this dashboard and see where we're at with the NFR in terms of not just in terms of participation, but also in some of the findings that we're getting from the questionnaire. And then we want to be able to provide information back to the participants. And so we can do that through email or text messages, and that would include the latest research, exposure reduction practices, and cancer screening guidelines. So obviously, for this to be successful, we need broad participation throughout the fire service. We launched officially in April of 2023. We have well over 10,000 firefighters who have signed up, and that's growing. So that's about 1,000 per month. But we have a long way to go to get to 100,000. And so we have to work. We are working with fire service partners across the United States. But we have a comprehensive communications campaign that we've developed that includes videos and brochures and fact sheets and all sorts of materials that are freely available on our website. So please check that out and please share with your communities. Again, we are very interested in reaching those populations that have historically been understudied when it comes to cancer. So women, wildland firefighters, and then other populations that have been underrepresented. So that's an ongoing effort, and that'll carry on for the next several years. In terms of support from the fire service, we have written support from 18 organizations as of this month. And that includes IFF, NVFC, IAFC. So that's, that represents career firefighters, volunteer firefighters, and fire chiefs, and then many, many other organizations that are listed on our website, and you can check that out as well. So I thank you for your attention. Hopefully, it's understandable how important this effort is. Knowledge is very powerful. And if we want to get in front of cancer, the NFR is one way that we can do that by learning more about firefighters' cancer risk and how we can reduce that cancer risk. Thank you for your attention. Happy to answer questions if we have time.
Can you do the mic? Sorry. So he can hear you online.
How does this relate to the PER and the UM app?
So we are looking at exposure tracking apps that are out there and how that data can be linked with the NFR. That's an ongoing effort. And so we actually haven't done it yet, but we are exploring that right now with N4s. Of course, we have a good relationship with the University of Miami, so we can look at it for PER. The NFR participant number that is being assigned when you register now is one way that we could confidently link other sources of data. And so, we can have those conversations, but there is a way to do it, and we're looking into it.
So you want us to do both?
Yeah, so because the PER app is more for exposure and your different incidents that you have record of, where the NFR, they're collecting it for registry information about, health history, cancer history, things of that nature. But it is a really important question that comes up often, with our cohort studies, with other research studies going on, saying like, well, should I do yours or should I do NFR? And they're complementary. So it's not one or the other. We're working with Kenny and with NIOSH to, promote that, firefighters should be in the NFR, as well as, participate in other studies. So it's not one or the other, definitely complementary. Any other questions? Oh, go ahead, Chris.
I have a question regarding what information is required for you to enter into the registry and the index? Is it essentially social security number, date of birth, and name? I mean, I've had some talks regarding this before, some other studies, and there's always the issue I get of the data leak questions that I try to fend off.
Yeah, so in terms of personal information, you pretty much nailed it. Name, address, email address, and then we ask for the last 4 digits of your social security number. We did, one of the reasons the NFR took a while to get up and running is because we are meeting the highest data security requirements for the federal government. And that includes multi-factor authentication to log in, encrypted, database, all the requirements to protect the data. We were worried about, asking for the last 4 SSN that we thought firefighters wouldn't provide it. So far, most firefighters are providing it. And it is an important piece of information. It just makes it a lot more, likely that we're able to pull in cancer diagnoses down the road if we have that information.
And one other question. What would be the differences, say, from the Daniel study from 1950 to 2009? Is there, that you're doing? It sounds very similar.
No, that's a great question. So the Daniel study is a retrospective cancer cohort study. Ours is a prospective cancer cohort study. The Daniels, I think his went to 2009 maybe. Most of the participants, most of the people in that cohort were employed decades ago. We're going to be looking at current firefighters over time, and it's a registry and not a records-based study. So there's some advantages to the way that we're doing it. We can actually collect information. We may come up with some other, information that we want to collect from firefighters. We can do that because we're following them forward in time.
You list some really interesting unanswered questions. I'm curious, over time throughout this prospective study, how you plan to disseminate your findings back to firefighters.
Right. So that's why having that broad support from the fire service is so critical. It's critical now because we're trying to maximize participation, but it'll be critical later when we try to get the information back out to the fire service. So we would be working very closely with those, fire service partners. Of course, we're going to publish in peer-reviewed journal articles, but most firefighters aren't reading that. So we're going to take the main findings, break it down in a way that firefighters and fire leadership can understand and do something about it. And then use our partners to get the information back out to the fire service, and then also work with, the standard setting organizations like NFPA, public health and medical communities, all the different, engaged partners that can, take the information and make recommendations and, hopefully prevent cancer.
One last question.
Question about the personal exposure reporting app that has, and is there any data sharing that's going on? That's my first part of the question. Data sharing between the NFR and the PER, and is there a value in having this NFR mentioned in the PER? So if somebody's filling out the personal exposure reporting app, at the end said, if you'd like to participate in the national registry, here's a link, just something like that.
So right now we haven't done the linkage yet. As far as sharing, I think that's an open possibility within either PER or within our toolkit or with any, other resource we have. We're happy to share that information.